Dear friends, uh, in this environment of the corona epidemic, we all are at home and we are want to save home and we want to make our country safe. But for the diabetes patients, amidst of this coronavirus epidemic, we should be a bit careful that there are 3 4 salient features we should take care of, like diet, especially diet should be with 1800 kilocalorie diet depending on the weight, 1600 to 1800. And there are the other option we can have it at home is the exercise and weight reduction if there is a more chance of metabolic syndrome. Metabolic syndrome means overweight, obesity, and hypertension. And pre-diabetic patients also may take care of in this regard. So 4 or 5 precautions we can take, like we should have the SMBG, self monitoring of the blood glucose. We can do at home. Glucometer is available to it is easily available at home also. And if it is required, then if the sugar is high, then if in the case of emergency, it can be purchased from the medical store. Medical stores are open for the emergency purposes. If the sugar is high, then we can do a self monitoring at home and we can make the chart 3 times at least, that before breakfast, before lunch, and before dinner. Or sometime random is required, then we can get the random sampling of the sugar. And the other thing we can do is the 3 monthly checkup of HbA1c. If the sugar is uncontrolled, then we can have a look on the HbA1c value in comparison to the previous one, whether it is decreasing or increasing. So we can have this. And we can take the value of fasting and PP, postprandial blood glucose level by glucometer at home if the services and there is a lockdown. So these things are there. And then we should continue our oral medications. So there is no contraindication for oral medicine. We can continue our oral medication if the sugar is uncontrolled under the guidance of your physician, treating physician, and endocrinologist or diabetologist. We can have the insulin if it is really required. And next we can do is SGLT2 DPP4 inhibitor drugs, which is prescribed by your physicians also. So the drug which were prescribed initially before the lockdown can be continued further if there is no change and your sugar is under control. The main problem is when sugar is not controlled, then you should be a bit careful. Then you should go for the consultation to the doctor. It will be better if you go with a chart, blood sugar charting, 3 times in a day, before breakfast, before lunch, before dinner, and the random blood sugar. And if you are really having uncontrolled sugar, then HbA1c value can be there. So all these readings, you can have the control your sugar. And main important thing is in the era of this lockdown and stay at home, you can do the exercise. It's a good opportunity that you don't have to go to the office and at your duty hours you are at home. So whenever you find the time, especially in the morning hours, in the evening hour, you can have the walk over the roof or at your home. You can walk inside the your hall and you can do some aerobic exercises also. So you can do 15 to 20 minutes of exercises 3 4 times in a day. So that will also help you. Morning walk, evening walk, treadmill, these are exercises which you can do. And number third is the blood pressure control. BP monitoring is important. As you know, the diabetes is a, you have to take care over the lifelong. So you have to control your sugar. You should have control on the BP also, and you can have the, in the diabetes there is a multi-organ involvement. If you control and there is a lifestyle modification, then it will increase your longevity of the life. And the sugar and BP should be controlled meticulously. And you should take the anti-hypertensive medications. You should take the anti-diabetic oral drugs, oral hypoglycemia, under the guidance of your treating physician. So that is very important. You should avoid this oily foods, especially when you are at home. So too much oily diet is not required. Multivitamin and fibrous foods you can take. And this is a lifelong care procedure. Diabetes management, it is a non-communicable disease. And so according to the American Diabetic Association, you should keep your HbA1c less than 7. So once in a 3 month, you should get the HbA1c value checked, and then you can have the idea that your sugar is under control or not. So with these words, I wish you best of luck for the treatment and self-management of diabetes under the physician care, in which you are already having your physician guidance. You should not stop your oral hypoglycemic medications at home. You should continue your diabetic drugs, and you should take the full precaution for the corona point of view. Use the mask whenever you go outside the home, and even if there is suspected patient at home, then you should wear the mask inside the home also. Now there is another point of self quarantine at home. So home quarantine is also a new concept. If the patient is asymptomatic, then he can get the home quarantine at home. In this era of coronavirus, you can control your diabetes very well. Thank you so much, and take care of your family and yourself, and do the exercise and lifestyle modification that is must. Thank you.